I'm Zsuzsanna Devecseri. I'm the global medical head of oncology at Sanofi, and I am the co-chair of the industry consortium and the co-chair at some way of the whole Pioneer consortium as well. The whole story started with the idea from the industry side that we have a lot of unanswered questions in prostate cancer, and why don't we get together, define those questions that we are looking for answer, and ask academia to partner with us to find answers. So this is how we started with Bayer and have other industry partners to participate, to put together those key questions where we wanted to answer. And with the help of a European Commission, we made our call at the IMI level, and then we got the proposal from different consortium, and Pioneer was the best one. So we were very happy to partner with the 23 academic institutions and form a joint consortium with the academic partners and the industry partners. I think we are very, very lucky because all these collaborations are based on people, and we have wonderful people working on both the industry side and the academia side as well. And I think we are all committed to patients and finding solutions and finding answers. So I haven't seen main issues in the collaboration, in any phase of the collaboration practically. It's a wonderful experience, and I think it's just going to get better and better as we go ahead, and we will start to see the first results of our work. We can't wait to see the result of the first analysis, that we can show that with the help of this collaboration, we can answer questions that the clinical studies, the traditional clinical method could not answer. It's not just on real-world data, because we are using randomized clinical study data as well. But I think real-world data is much more important than the clinical study data, because that represents how the disease actually behaves, how the individual patients respond to certain treatment, and in a much bigger scope, geographically and ethnically, than we've seen in the clinical studies. And ultimately, we don't want to treat clinical study patients. We want to treat real patients in the real world. So in the last 12 months, we looked at the different state of the clinic of prostate cancer from the early stages and the late stages of the disease. And we tried to identify, based on the literature and based on the clinicians' input, which are those disease outcomes or treatment outcomes that are the most critical for the clinicians and especially for the patients. So after 1 year, we achieved to identify the outcome and prioritize the outcome measures for the localized, locally advanced, and the metastatic disease states. So outcome, for example, is how long a patient lives. The outcome is that when the disease progresses. The outcome can be how the patient feels, what the quality of life. So in different disease stages, we can define different objective and subjective outcome measures. And measure is a very important word here, because everything what we look for, we want to measure. And we want to quantify, even those are very qualitative measures we want to quantify. So it sounds complex, but it all goes back to how the patient feels and how the patient reacts to the treatment. I think it's from the very beginning we work with patient groups, but in the outcome definition project, we are specifically having close interactions with patients, either in face-to-face qualitative interview process or in patient panels, because we want to make sure that everything we come up with based on the literature or idea and knowledge about the disease resonates with the patients whom we are ultimately treating. I think to me is being especially a co-chair on the industry side to make sure that all the industry partners contribute equally, or at least what we promise we will deliver, and to make sure that everybody finds that place where we can have the highest added value for the project. I think in the next 12 months we will need to reach the phase where we will have data sources accessible for research questions, and we will start to interrogate the data sources. And I think this is going to be a very, very exciting and interesting time that we will see the first results and the process what we design and turning to blossom or maybe to fruits.